security for America.
Well, Ukraine's also heavily reliant on foreign aid to sustain its healthcare system. Since the war began, at least 1,500 medical facilities across the country have been damaged and countless medical workers killed. But despite this, the country's healthcare system has held together and in some cases overperformed, but needs sustained support to maintain its services. Well, for more on this, let's go to Dr. Hans Kluge, the World Health Organization's Regional Director in Europe. Mr. Kluge, thanks, Dr. Kluge, thanks for joining us here on The World Today. Let me ask you, first of all, to give me a little bit of insight into what the needs are in Ukraine in terms of its healthcare system.
First and foremost, it's amazing and inspiring that its health system is still standing because it has endured an unimaginable stress. And it's because of the heroism of the healthcare workers, the leadership of the Ministry of Health, and very important, the international support. So there can be no fatigue. Now, on the needs, it's a very complex picture because on one hand, still life-saving support, particularly at the front line, is very important. Like, for example, to treat chronic diseases, hypertension, diabetes, together with trauma. Every single day, there's about one spinal cord trauma patient day by day. And at the same time, the Ukrainian Ministry of Health need to ensure access to the essential health services, including preventing outbreaks of vaccine-preventable diseases, tuberculosis, HIV.
Let's talk a little bit about where the support for Ukraine's health system is going to come from right now.
Well, it's very important that the budget support continues, particularly for salaries and medicines, because there is obviously a huge fatigue, burnout. The doctors, the nurses, each time I go to the front line, I see surgeons who are operating by candlelight and still have not gone home for more than a year and a half. So we need to support them also. Mental health, family care, the working conditions, that's one very important one. And the country itself is doing whatever it can. And it's important that the foreign aid is aligned with the national strategy, because it's not a country where the health system is broken. There is a strong health system. We have to strengthen the public health institutions. So the coordination is very important.
Let's talk a little bit about the global pandemic agreement. Countries are currently negotiating the final text for that. Clearly, we all know that that's important, but let's assume that we have another COVID-19 type pandemic. With this global pandemic agreement in place, what is going to be different if we do go through a similar scenario?
There are two very big lessons learned from the recent pandemic. One is that no one is safe until everyone is safe. Number two, the most vulnerable people in the population are hit twice. So healthcare workers in the whole world will have the tools to do their job. And very important, then there will be an agreement on timely exchange of information, data, the pathogens, and the sharing of vaccines, because equity was what was lacking during the pandemic. This is a generational opportunity and we cannot miss it.
OK, Dr. Hans Kluge, Regional Director for Europe, the WHO. It's good to talk to you. Thank you for joining us.